Hi everybody, my name is Dr. Flora Sinha. I am a board certified internal medicine physician practicing in Southern California. Thank you so much for joining me on our conversation regarding your health. We are going to be chatting about a few things today. First and foremost, what is primary care? What is preventative care? Second, what should you as a patient expect to talk about with your primary care doctor when you go in for your preventative care visit? And lastly, what lifestyle modification and changes can you incorporate into your life to help you live a longer, healthier life? So, what is primary care? A lot of the times we think about going to the doctor to fix an ailment, right? Something isn't feeling right. You're noticing something that doesn't look right. So you go to the doctor to fix it or to figure it out, get some answers. But there's such a huge portion of medicine, which is preventative care. And that's basically 50% or more of what I do day in and day out. How can you prevent disease before it even starts? And that's where we get into vaccinations and cancer screenings and taking into consideration your genetics, maybe doing lab work, a physical exam head to toe, and really trying to prevent disease before it even occurs. So, it is really important to visit your doctor at specific intervals, depending on your risk factors, depending on your age. That's a personal conversation absolutely to have with your primary care doctor. Now, know that this is a general overview. There may be some screening exams or vaccinations or other things that you may want to bring up or your doctor might bring up during your preventative care visit. But this is just a generalized view just of the regular population. All right, so we are going to move on to what happens during your preventative care visit when you go in with your primary care doctor. Let me preface this presentation with the fact that I'm an internal medicine doctor, meaning I see adults only, and there are other physicians that also practice primary care, like family medicine physicians, OB-GYN for your women's health, and obviously pediatricians for children. So vaccinations is such a fun conversation I usually have with my patients because it's such a hot topic, especially here in the US. But let me just start off by saying vaccines save lives. There is a ton of data about this, and we practice science-based medicine. A lot of disease have been nearly eradicated because of vaccinations. So I'm just going to move on from that. And I'm going to start with speaking about the HPV vaccine. So what is HPV? It's virtually all cervical cancers can be attributed to HPV, which is a virus. It can cause other cancers and diseases, but it's lower in incidence compared to cervical cancer, which is globally the fourth most common cause of cancer in women. The HPV vaccine is a series of 3 shots. It's also known as Gardasil, so you may have heard, TV commercials or flyers or something about that. And it targets the same HPV types that is most commonly linked to cervical cancer. Most patients will start receiving this around the age of 11 or 12. So a lot of patients that do come to me who are on the younger side have already received the series with their pediatrician. But if they haven't, and if they're under 26, I will offer to have them play catch up with the HPV vaccine. Now, mostly insurance companies will approve HPV vaccine until the age of 26. Overall, the vaccine is effective until the age of 45, but just be aware that your insurance company may not completely cover it. So just call them, ask them about it if you are interested in it, and if you've spoken to your doctor and you are a candidate for that vaccine. The next one I'm going to talk about is called Tdap, T-D-A-P. It stands for 3 diseases: tetanus, diphtheria, and pertussis. The tetanus vaccine, or the Tdap series, is usually given every 10 years, and it covers 3 diseases. Tetanus and diphtheria, because of universal vaccinations, we've actually seen a really low rate of them, especially in the US. I've only seen maybe one case of tetanus, and that was in residency. And the patient was not vaccinated, and he did work in construction, stepped on a really old nail, and it was a really sad case. I'll never forget it, which is why I am so passionate about vaccinations just in general. And then diphtheria, I have maybe seen one or two cases after I graduated residency, and they have been mostly in patients who were traveling in endemic areas, who weren't vaccinated or inadequately vaccinated, meaning they didn't get their booster. So that 10-year mark, every 10 years, we recommend either the Tdap or the TD booster to help protect all of you guys. Now, the last portion of this is pertussis. So pre-vaccination, it was probably the most common cause of illness, causing this really violent cough in children. Because of vaccination and because of the series starting when children are younger, we see the greatest population in young adults and adolescents. They become kind of a reservoir of pertussis, also known as whooping cough, by the way. And they serve as a reservoir to infect kids who are too young to be vaccinated, or the elderly who just don't have the immune system or may not be adequately vaccinated. So it's really important, especially if you're going to be around children or if you're regularly around them, to make sure you're up to date on the Tdap vaccine. You will also receive the Tdap vaccine during your 3rd trimester of pregnancy to protect the baby, and that's regardless of when your Tdap shot was. The next one is the pneumococcal vaccine. So pneumococcal is a bacteria most commonly causing pneumonia, especially in elderly patients. Now, just up until recently, the pneumococcal vaccine was a series of 2 shots protecting against 2 different strains. But now only one strain is recommended as a scheduled vaccine. The other one, again, talk to your doctor about it. You may be a candidate for it. Because those above the age of 65 have a higher incidence of pneumococcal disease, we recommend the Pneumovax vaccination in that age population. Now, there are other populations younger than 65 that may have an indication to get vaccinated, and those are smokers, people with chronic lung disease. Like I said, make sure you talk to your doctor and let them know about any type of chronic disease to ensure that they catch that. The last one, or actually second to last, is the shingles vaccine. So about 3 to 5 years ago, the new shingles shot came up. It's called Shingrix. I'm sure you guys have heard of it. It's recommended in those above the age of 50. What is shingles? If you haven't heard of shingles, it's awful. It is a reactivation of the chickenpox virus. It causes this really painful rash. It could occur anywhere on your body. And what's really scary about shingles is a certain population of patients may develop chronic nerve damage from the shingles disease. So the rash will be gone, but in that area, there'll be permanent nerve damage. And it's really frustrating for patients and for doctors because it's just really tough to treat and really tough to control. Patients seem to be very uncomfortable. So the Shingrix vaccine has up to a 97% efficacy. That is a really, really good rate, totally worth it. It's a series of 2 shots, and not only does it help prevent shingles, but if you happen to get shingles, it actually decreases your risk of having that nerve damage thereafter. So definitely get your shingles shot. Like I said, it's recommended for those 50 and above. And the last one, my favorite, is the flu shot. Every year I have really great conversations with my patients about the flu shot. Here's the bottom line. Is it perfect? Is it 100%? Absolutely not. It never really is. And the most common myth that you get the flu after getting the flu shot, I usually pose this question. Why would I, as your doctor, someone who's devoted their entire life to protect patients, give you the flu? I'm gonna let you mull on that for a second. Okay, now that you guys have mulled over that, I'm going to tell you guys a story. In residency, I got the flu. Of course, I was vaccinated. I obviously caught a strain that I wasn't vaccinated against. And I was out, you guys, for 7 days of recurrent high fevers, really bad body aches, the shakes, cough, chest pain, and the fatigue after I got over the illness kind of lingered. It really hit me. And so I always think to myself when I'm talking to patients about the flu shot, if it hit a young, healthy adult that badly, I can't imagine what it would do to patients who don't have a strong immune system. Perhaps children, older patients, patients who are on medications that suppress their immune system or have diseases that suppress their immune system. These are the patients that we see in the hospital. And every year I see at least 1 to 2 of my young, healthy patients also end up in the hospital because of flu. So get the flu shot for yourself, get the flu shot to protect your loved ones, and hopefully we can all be healthy during our flu season. The flu shot is usually offered between the months of August and March, sometimes in April, depending on the flu season. Next, we're gonna get to cancer screening exams. I love starting with colon cancer screening because I always see my patients kind of shift in their seat and giggle and get really uncomfortable. There are multiple ways to screen for colon cancer. The gold standard is a colonoscopy. Now, the most common question I get is, why do I want a camera shoved up my butt? I think it's a valid question. Or I don't want anyone shoving a camera up my butt or looking at my butt or looking at my poop, or the list goes on. If you guys think about it, gastroenterologist, the GI doctor that will be performing your colonoscopy, signed up for this. They on purpose trained for this. They love poop. They love intestines. They love butts. I think that should be a song. But this is what they do day in and day out, and they've been trained for this, and this is what they signed up for. So no reason to be embarrassed. There are other ways that are non-invasive to screen for colon cancer, and that's through the stool. So ask your doctor for a variety of ways to screen for colon cancer. The stool tests they're done every year if they're negative, and what they do is they test for microscopic blood. If the stool test is positive, meaning that it detected microscopic blood, that buys you a colonoscopy. If it's negative, then we repeat it every year. The colonoscopy, depending on what they find, will be due every 10, 7, 5, or 3 years. Now, if you have a family history or a personal history of colon cancer, please talk to your doctor, because the starting age, which is normally at 50, the starting age of colon cancer screening will change, and the increments, meaning how often you get the screening done, will also change. So talk to your doctor about that. There are a couple of other ways to screen for colon cancer, but just make sure you start a conversation with your physician. The next one is cervical cancer screening. So we talked about the HPV virus and the vaccination to prevent HPV. Now this is cervical cancer screening, which is your pap smear. Pap smears usually start at the age of 21 and usually go until the age of 65. Again, all of this depends on your risk factors, your family medical history. If you're under the age of 30, your pap smears are due every 3 years if they have been negative and if you are low risk. 30 and above, your primary care doctor or your gynecologist may test for not only the cervical cells, but also for HPV, so meaning co-testing. If they're co-testing, you're low risk and you have negative results, your pap smear is due every 5 years. The funniest comment I get before I do a pap smear is, "I'm really sorry I didn't shave," or "I'm really sorry about what you're gonna see down there." People, again, I signed up for this. I'm good. No reason to apologize. I usually tell my patients, I've seen, heard, smelled just about everything. Really, nothing is surprising for me, and no reason for embarrassment. This is your body and you're here to protect your health, and I'm here to help you with that. So no apologies about shaving, hair, I don't know, anything else you guys are apologizing about. The next cancer screening is breast cancer screening. Breast cancer is one of the most common causes of cancer in women, and one mammogram could save your life. I have caught so many cancers in women who were low risk and who just went in for their screening mammograms, and just with that, their entire lives have been changed. And they've been changed, but because we caught it early and they were treatable. And it's so powerful to know that, one screening exam could change your entire life. So go get your mammograms. I recommend starting at 40 years old, getting them every year. Like I said, like everything else, depending on your risk factors, depending on your family medical history, the increments of how often you get the mammograms may change, and the starting age may also change. So please talk to your doctor and know your family history, so we can together make an educated decision about how often to get your cancer screenings. The last screening exam isn't one for cancer, but it is for osteoporosis. We screen for osteoporosis in patients 65 and above using a DEXA scan. Now, osteoporosis is a disease that thins your bones. And as we age, being South Asian and being a woman increases our risk for this. There are other diseases and syndromes that will also put you at risk for osteoporosis other than just simply age. So again, talk to your doctor and make sure that you don't need to get screening done earlier. If your screening is negative, then the screening is done every 5 years when it comes to osteoporosis. And then next, we're going to be talking about lifestyle modifications for you to start doing whenever, the sooner the better, to make sure that you prevent disease and live long and healthy. We are going to end with lifestyle modifications. There's so much information out there that it can be really overwhelming and really confusing. So I usually like to end my preventative care visits and talk about with my patients about how they can make small lifestyle tweaks to help them feel mentally and physically better. I usually start with skincare. Just because we have a little bit of color in our skin does not eliminate our risk for skin cancer. Please wear sunscreen. Make sure it's in your daily moisturizer. Apply sunscreen to other bare skin areas that will be exposed to direct sunlight. And if I can't convince you from skin cancer, it'll also prevent wrinkles. So keep that pretty face real pretty for a long time. The next thing I talk about is eating habits. I usually don't like using the word diet because it can have a negative connotation. I'm sure at least once everybody here has had an auntie come up to them and ask them to stop dieting because they have lost too much weight, or start dieting because they've gained too much weight. I still get comments like that. So it just puts me in a really uncomfortable position. So I usually say eating habits or eating plans. It's super important to really be mindful of what we're putting inside our bodies. South Asians do have an increased risk of hypertension, diabetes, heart disease, stroke, and we could blame it on the lack of we could blame it on poor eating and lack of exercise. Traditional Indian dishes, not all of them are heart healthy, especially the fried snacks, the heavy sugar content sweets. Nowadays, there are so many healthier substitutions that we can make those traditional dishes with. And especially out on social media, a lot of people are doing really great things and kind of reinventing the wheel, to make sure we have good meals and healthy meals, and still, be able to reminisce about our childhood favorites. I usually start by telling patients to cut out processed foods, processed flour, processed sugar. Another step they could take is decrease and or eliminate red meat. That is the first step. Now, whether you're doing intermittent fasting or low carb or being vegan or vegetarian, I think overall, you can follow that general rule of cutting out processed foods. You'll feel better. Your gut will feel better. You'll have more energy mentally and physically. And then as far as details of that, I will go into a little bit specific details about what is considered processed and what is not. The next lifestyle modification I talk about is exercise. Again, lots of info out there. What do we do? Cardio and weights. Sounds easy. Cool. I'm done. I'm kidding. So, just cardio, just weight training, both of those put together, I think is the best combination to not only aid in fat loss, but also to make your bones stronger. So I talked about osteoporosis earlier. By weight training, so lifting weights drives calcium into the bones. And again, us being South Asian and a particularly higher risk factor ethnicity, it's really important that we do start weight training. I even tell my older patients who are at risk for osteoporosis or who have osteoporosis to start lifting weights. Start low, slowly build up. There are plenty of resources and programs out there to help you and to guide you. And I also will tell patients, hire a personal trainer. Maybe not right now amid a pandemic, but it's probably the best investment I had made, just so I can learn a little bit about what to do, what not to do. And overall, please do not injure yourselves. When it comes to cardio, I recommend at least 30 minutes, at least 3 times a week. I'm not talking about a gentle stroll down the street. I'm talking about moderate intensity exercise. Get that heart rate up. Moderate intensity exercise could be considered, you could be breathing hard enough that it's difficult to hold a conversation. That's a good guide to live by. And overall, it's good to have a routine, but have backups. Don't have exercise as your backup plan. Have exercise into your routine, but if you can't do a specific exercise, have a backup plan for that. Exercise is not an option. Do it for your health and for your family. The last one is near and dear to my heart. I talk about mental health with all of my patients. We do screen for depression, and if that screening is positive or if the patient brings it up, we talk about it. Depression, anxiety, any type of mental illness is really a stigmatized topic in the South Asian community. Having a history of depression and anxiety in myself, I've gone through, a lot of conversations with family members, with friends, who just didn't quite understand or were too embarrassed to talk about it. Look, our mental and physical well-beings are so closely connected. I have seen on numerous occasions where those struggling mentally will start having physical manifestations of poor mental health. So how do you get good mental health? The obstacles aren't going to stop. The stressors aren't going to stop. That's what life is. So try to get to a balanced mindset where you're ready for those obstacles, where your expectations isn't to go through life coasting, because that's unrealistic. And I usually tell patients to really shift their mindset to be ready for this. Meditation can help. I personally use guided meditation apps like Calm. I recommend Headspace. They've really helped me kind of neutralize what I'm feeling. It's really easy to go to extremes. Either we're excited, elated, happy, or we're angry and frustrated and stressed. Let's try to get to the middle. It's okay to have those extreme emotions, but then get right back to the middle where you belong, where you're in contentment and in a satisfaction type environment. Also, it's okay to go to therapy. If you are struggling for whatever reason, whether there is a trigger or not, get help. Talk to your doctor about resources. Go to your insurance company. Talk to your friends. Talk to your family. There are so many resources out there for you. It doesn't all necessarily include medication. And guess what? If it does, it's okay. This is your health, your future. Please invest in it mentally and physically. That's it, you guys. I'm going to hop on here in a little bit for to go live for some questions. I really hope you guys enjoyed this. And again, thank you so much for listening.